Hello, I'm Tracy. Let's talk about medication safety. National Patient Safety Goal number 3 states, improve the safety of using medications. Duh! Okay, what does patient medication safety mean? Let's take a closer look. We want you to remember that before a procedure, label medications that are not labeled. Take extra care with patients who take medications to thin their blood. Record and pass along correct information about patients' medications. Now let's tune in into one of our end of the shift discussions.
Alright you guys, now that we're finished with today's shift report, let's take a little moment to discuss medication safety. Have any of you guys observed anything as far as with patient labeling? How about you over there, Sally?
Yes, Miss Tracy, I actually had a couple things come up on my shift today. They were really surprising to me. The first one actually came from the pharmacist. It was interesting. My physician ordered 260 milligrams of Taxol for one of my chemotherapy patients. And when we got the script from the pharmacist, it was 260 milligrams of Taxotere.
What?
Yeah, so, I mean, I know you know both are chemos, but when we went to look up the medications, like, the dosing for both of them were so different that if we'd have given it, we could have actually had a fatal incident with the patient.
So pretty much this was an example of why we have to pay attention to the names and the labeling of medications, right?
Yeah, definitely, and reading back orders as well. I feel like maybe if the physician and the pharmacist would have talked a little more, maybe spelled out the med instead of trying to say it, maybe it would have helped a little.
Right, good. That's good. That's really good. I'm glad you caught that, Sally, because we definitely don't. Our whole overall goal is to prevent harm to the patient, and observing that definitely saves someone's life. So good job, Sally.
Yeah, my patient, she actually let me know as well because she was unfamiliar with the drug's name when I went to verify it with her. So she was asking me about it. So when I pulled up her chart, that's actually when we saw that it was the wrong medication.
All right, going forward, did anybody have anything they observed as far as with their patients on any anticoagulations treatment?
Well, I did, Tracy. I actually had a problem. We had a flagged same name patient on our floor today, and what happened was received a dose of Coumadin that was not in her chart. So what happened to the patient was she started to hemorrhage it. I had to do 2 doses of vitamin K to try to get under control. But I feel like this could have been prevented if someone would just check the chart. Make sure that even though we have the same name patient, I feel like we should have checked the chart to make sure that it was the same date of birth, the same medication listed in the MAR, as well as checking their coagulation levels, because we would have known if this patient was on a blood thinner.
You're right. You're absolutely right, Jim. You're absolutely right. I think that would have been a key. Always paying attention, especially with the patients who have the same name and we are flagging them in our system as a same name patient. You definitely want to check the MAR, like you said. You want to make sure when we're scanning the patient's ID tag, make sure it's the correct date of birth, that is located in the patient's MAR, and it's not something that's not there. Because, like you said, this was a hemorrhaging situation, and this can also lead to patient death if not caught sooner. And I do applaud you for actually correcting it.
Whoa, that was a lot, so we're just going to wrap up right here. Remember, when passing along correct information to the patient, you want to give out clear, precise handouts, a good contact number for any questions, and advise them not to search the web for any explanation. Ooh, I know you guys are tired, because so am I. Statistically, 36% of patient error happens with medications. Medication safety is very important. Remember, right patient, right medication, right time, right route, right dose, right documentation, right reason, and right response. Thanks for watching.
Created using Powtoon.